I'm Dr. Eric Waldon, Program Director of Music Therapy at University of the Pacific in Stockton and San Francisco, California. And I'm talking to you today about CMPAC, the Computer-Based Music Perception Assessment for Children. The gap in clinical practice addressed by CMPAC really evolved around clinical challenges that pediatric music therapists face when they're working in the pediatric setting. For one, young hospitalized children may show some initial reluctance when approached by a music therapist, when a music therapist may be talking about music that they like listening to. The children developmentally also may be unable to articulate the types of music that they like to listen to. And then it's also important for music therapists to determine a child's music preferences and responses when planning treatment. So the assessment question that is addressed by CMPAC is, what are the music-related responses and preferences of young hospitalized children? The assessment tool itself was developed at University of the Pacific, and the team was led by Dr. David Wolfe, and then by myself and also a colleague of mine, Tiffany Goodman-Bilby. Because this is a computer-based tool, we also had some programming experts, Yaroslav Kapuczynski and Daryl Bodley, also at the University of the Pacific. And then we had some field testing by some music therapists. The tool itself is designed for hospitalized children ages 4 to 7 years. The tool itself should be administered at the point of admission to the pediatric unit, again, being important to establish some music preferences and some musical responses as early as possible in a child's admission so that information can be used by the music therapist. It's a prescriptive assessment tool, which means that the tool itself generates actionable data that can be used to prescribe a course of treatment. And as with all assessment tools, and from a database decision-making approach to assessment, CMPAC is to be used in combination with reviewing records, interviewing, and other important observations. To administer, you need the CMPAC software, and I'll talk about how to access that. A laptop computer. CMPAC was originally developed for use with a laptop, and unfortunately has not been updated for tablets or touchscreens. Using well-fitting headphones, and some means of taking observational notes, whether that's a paper and pencil or a digital means of taking observational notes. And it takes about 10 minutes. And the 10 minutes was established through some of our field testing, which suggested that 10 minutes with the assessment tool was enough to establish music preference, as well as some important musical responses. So the computer software, here are a couple of screens from the software itself. It really involves first taking the child through a tutorial of how to use the computer-based system. And it's really interesting to think about children are really quite familiar with the world of technology, where the rest of us, sometimes it feels like we're visitors. Older people, we tend to be visitors to the world of technology. It's quite an intuitive interface. Again, this version was done with a laptop computer and a computer mouse. And if this was to continue to evolve into more of a touchscreen approach, again, I would imagine that it's still quite intuitive. But the protocol itself takes the child through a tutorial how to use the system. And when the testing actually begins, a child is shown a picture on the left side of the screen of different pictures of music. And behind each picture are some songs about music. And so let's say if the child clicked on the upper in the upper left-hand corner, the Sesame Street icon, that would take them to a music menu with more pictures of music, and the child would click and then listen to a selection of music, and they could switch selections that they're listening to, and they can also go back to the menu and they can choose a different genre of music. They can start the music, they can stop the music, they can go back, etc. Meanwhile, CMPAC itself is collecting a lot of important clinical information. Particularly, it's collecting digital information about the frequency of their listening. So which selections are they going back to, or they're listening to most frequently, how long they're listening, overall length, as well as how long are they listening to certain music selections. It's also showing the chronology, the order in which that they're listening and sampling pieces of music. And there's also a place within CMPAC where you can enter into the system some of your narrative observations. It's really from this clinical data that the music therapist is able to maybe make some determinations about music preferences, and also some of these observations about how does the child respond when they're using music. For example, if the child was experiencing some physical discomfort, as soon as they're listening to music through CMPAC, do we see a change in their observational signs of distress, for example? We did publish a study looking at the kind of the usability of this technique of CMPAC. One of the things we did in this published study is we established some retest reliability or stability. One of the things that we were looking at with a non-clinical population, we wanted to see whether or not the evidence that we received on one occasion was consistent with what we would find 1 or 2 weeks later. And there was evidence of measurement stability, meaning the behaviors and the preferences we saw on one occasion matched up with the behaviors and the preferences that we saw on a separate occasion. This is important because we kind of assume that something like music preference and responses to music is a relatively stable trait over time. And so we wanted to establish that what CMPAC is measuring, it's measuring a stable trait. Okay, so that's retest reliability. And with regard to validity, we looked at a specific type of validity, something we call predictive utility. Predictive utility is how helpful would data generated from CMPAC be to a music therapist who is using it clinically. And so in our field testing, we collected data from a clinical sample of administrations, and then we gave those clinical profiles or the summary results to a panel of music therapists, and the music therapists were then asked to determine how useful or whether or not there's an agreement on the usability of this data. And there was significant proportion of the music therapists for whom we gave this data to, they said that yes, it would be helpful in making referral and in treatment decisions. Some consideration, there's no specialized training required to use CMPAC. However, it is highly recommended that whoever is using the tool have a familiarization and some competency with clinical assessment. And I say that a competency in clinical assessment goes beyond simply being able to follow a protocol. It involves, administering and maintaining rapport during the process of testing. The current format, this was published, we did our study in 2006. It was published in 2009 in a textbook published by the American Music Therapy Association. The current format that it exists in CMPAC is static, meaning you can't change out any of the songs. And those songs also reflect kind of a Western dominant culture bias. So that's something to think about and to take into consideration when you're using CMPAC as it currently exists. Really, what should happen is the software should be updated to allow music therapists to change music selections based on patient preferences, cultural background, and also updating the system to allow music therapists to not only make changes to the different selections that are in there, but also to make it more flexible in a touchscreen tablet format. That would certainly make a lot more sense, I think, given today's technology. You can access the CMPAC itself and its current iteration through this textbook, Music Therapy in Pediatric Medicine, published by the American Music Therapy Association. It is included among other protocols that David Wolfe and I published back in 2009. If you have any other questions, you can certainly feel free to contact me. My email is ewaldon@pacific.edu. Thank you for listening.